This is a brief introduction into how we do an assessment of irrigation techniques. This is a GentleWave case. It's an in vivo case. It was a necrotic tooth in the mouth where minimum shaping was done, a GentleWave procedure was done, and then the tooth was extracted and sent to me. So normally you would expect this tooth to be filled with biofilm and bacteria. So what we do is we section the tooth and place it in the SEM, and then we try to do kind of a global survey of what the canal wall actually looks like. And there's a considerable amount of pattern recognition involved in this, and it does take some training to spot areas that you really want to examine closely, because biofilms can be very difficult to identify. So we use various magnifications, 30x up to 30,000x, to do our bug hunt. Basically, that's what we're doing. We're hunting for bugs. So as you look at this, it has kind of the typical GentleWave appearance with various decalcifications of the dentin, exposure of the dentinal tubules. And in just a cursory examination, I don't see anything that looks suspicious to me as far as a biofilm goes. There's almost no tissue at all. Can't see any tissue remnants at all. And as we survey this, we use kind of a disciplined approach. We do it in sections. I won't do that here. I'm trying to give you a broad overview of what the canal looks like. But basically, we're looking for a certain signature of what biofilms look like. Now, we have these little round things that almost look like yeasts. They're a little large, and we don't actually know what those are. I'm going to talk about those a little later. Initially, we thought maybe they were bacteria or yeast or fungi, but they're not, as you'll see. Now, when you go in and survey this, what you notice is that the predentin is differentially decalcified down to the dentin. So that has a very specific signature and appearance. And you can see that most of the predentin here has been dissolved away by the EDTA. There you can see what it looks like. It looks like an ice cube that's melting in water. And as the EDTA works, that predentin is completely removed down to sound dentin. There you can see these little round balls that we're going to talk about later. And there you can see what the dentin looks like, predentin looks like as it's being dissolved away. It does have a signature very similar to biofilms, so you need to be careful that you don't mistake that for a growing biofilm. So you need to look at these under much higher magnification to be absolutely certain. But in a general survey of this, it looks exceptionally clean. There you see an area of predentin that's in the process of being decalcified. And you see a lot of these round bodies and the differential decalcification of the predentin. Now, I'd like to just put this in context to look at what a conventional cleaning and shaping in a necrotic tooth looks like. So I've done literally thousands of these. So to give you some insight into what you typically see when you look at just a normal irrigation, needle irrigation, and conventional cleaning and shaping. So this is what a conventionally cleaned and shaped canal looks like. And you can see there's typically debris everywhere. You can see some evidence of the tubules in places, but there's a tremendous amount of debris. And almost always in these cases, in necrotic cases, you'll find remnants of a biofilm in its EPS matrix. So we'll take a look at these at higher power. And when you go in, it has kind of a similar appearance to the decalcification of the predentin, but you need to be careful. As you go into much, much higher power, you can see that this isn't just the decalcification of the predentin. This is a very robust bacterial biofilm, actually impregnated into the dentinal wall, or perhaps that's even some endodontic cement. It's hard to tell. But there are many, many organisms present in this. And we're up to a 1500x to see. And as we go up to almost 5000x, it becomes very clear that these are organisms that were in this case. So just as context for the other GentleWave case we're looking at, this is very, very common to see in necrotic teeth that have been just had conventional cleaning and shaping and irrigation. There you can see some of the, it looks like predentin that hasn't been decalcified. And you can tell just by the look that this is an aged biofilm. Those bacteria have been there a long time. So back to our case, as we go through our survey, we're looking for certain signatures here. And then we still wonder what these round bodies are. So we decided to maybe look at those a little more carefully. And if you look carefully, you can see there's actually a process that goes down into the dentinal tubule. And that cell body there seems to be supported by the predentin. And when the predentin is eroded or etched away, that cell body is left alone. And I think the only inference you can make here is that these are odontoblasts. So it's very unique that the GentleWave can remove all tissue, all biofilms, and yet leave the odontoblast intact. It's almost like washing your hair in shampoo and scrubbing it like crazy, but not pulling the hair out. So I think this is a very interesting finding, and I thought you'd enjoy kind of seeing this. As you can see, there are no bacteria anywhere here. There is just basically the dentin, the predentin. Most of the contents of the dentinal tubules have been etched away or dissolved away. There you can see an odontoblast in the predentin that hasn't been etched away yet. So it's actually in the right location. And there you can see the cell process that goes right down into the dentinal tubule. And as you look carefully around and do your survey, you find these everywhere. And here's a higher magnification view of the process and the cell body of the odontoblast. And it looks to me like it's completely intact. It hasn't been damaged by the irrigation. So it's really incredible. So going back, it looks like the GentleWave on this case cleaned it exceptionally well.